we're going to go ahead and get it started. For those who don't know me, my name is Dan Foley. I'm a physical therapist with React. I work up at our Wilmette Clinic, and I've been here for about 2.5 years. Today, I'm going to be talking to you guys about hip tightness and associated pains with hip tightness. Chose this topic because we've been seeing a ton of hip-related issues or low back or knee pain that tend to stem from hip issues in clinic, especially since the pandemic started. My guess is it's workstation changes, but because I've had so many patients, I figured it'd be a good idea to do a webinar on it. So I hopefully today what I share with you will help you guys or anyone else out there who is dealing with any sorts of hip conditions or low back pain or knee pain. So we're going to get into it now. Before I share my screen, there's going to be kind of two sections to this webinar. One, I'm going to talk about kind of hip anatomy, associated musculature, various pain syndromes associated with hip tightness and hip issues. And then we'll open it up to a little bit of a chat. And you'll notice there's a chat feature on Zoom. If you have any questions, you can post them there. While I'm sharing my screen, I won't be able to see them. That's why we'll take a break at the halfway point and I'll review the chat room before we get into the second section, which will be more exercise demonstration. I did pre-record the video, so I'll be able to talk through them as we go. But if you have any questions, either hold on to them until we take a break or the end, or you can post them in the chat. Just know that I'll do it once we get a break. All right, so I'm going to go ahead and share my screen here. Bear with me. All right, so screen share. Going to get the slideshow going. All right, so combating hip tightness. So again, all the time in clinic, we hear patients say, my hips are tight. Why do they get so tight? Number one answer I can say is because most of us sit most of the day. Most of us have jobs where we're sitting at a computer for prolonged periods of time. Most of us are working 5, maybe 6 days a week and sitting in those positions. And our joints, our muscles, they don't like that. We are built to move. And by staying in prolonged positions, including standing, it's not always sitting, but sitting's the most common, our muscles get tight. Day in and day out, they stay in those short positions, they get tight. And in turn, because our muscles make our joints move, if our muscles get tight, our joints are going to get stiff and tight as well. So if there's one takeaway from this whole webinar today is this: moving consistently throughout the day is the best way to combat hip tightness. If any of you guys that work with me out there, I was saying, your best posture is your next posture. There's no perfect posture that's going to make your hips a little looser. You got to keep yourself moving throughout the day, and that's going to be the best way to keep yourself loose, especially our hips. Our hips are built to have very large range of motions. We need to use them. They move forward, back, side to side. They rotate. Each of those directions, they move a lot more than most of our joints. Our hips and shoulders move a lot. So we got to use them. If you don't use it, you lose it, right? We need to, engage those range of motions, engage the muscles around them. But that's not the only reason. Some of you might be saying, well, I move out throughout the day. I have a job where I'm on my feet a lot. My hips are still stiff. There's other reasons that hips get tight. Previous injury to either the hip itself or, joints around it. When we get injured, our muscles guard and they get really tight to protect us, or sometimes we have to compensate because of injury, and that's going to cause us to move differently and cause some muscles to get tight and some to get to be overworked. Overuse is another reason why hips get tight. Overtraining or poor training habits, running too much, lifting too much weight. If you're someone who exercises a lot and feel like they're in a good plan, but their hips are constantly stiff and sore afterwards, chances are you're overworking. We're not getting into too much, training techniques specifically today, but that can be a reason. And then another one I always like to share is dehydration. If you're chronically dehydrated, your joints, you will feel stiff, especially in muscles. Your muscles will get dehydrated. So staying hydrated throughout the day can be very beneficial for that too. So when we talk about the hips, what is the hip joint, right? So your hip joint is considered, if you look at the figure here, it's your thigh bone. At the top of your thigh bone, it's called your femoral head. This sits in a socket created by your pelvis called your acetabulum, and that is the hip joint. And you can see it's a big socket. That's why it's allowed to move in so many different ways. It has a lot of degrees of freedom, is what it's called. And all around it, if there were muscles and soft tissue around here, you'd see a ton of muscles attaching from the lumbar spine, which is up here, your sacrum, your pelvis, lower in your pelvis, like at your pubic bone area. A lot of muscles are attaching from there all along this femur and pretty high up on it. I believe 17 or maybe 18 muscles alone attach onto one hip. So again, when you think about it, if there's that many muscles attaching, if there's one stiff muscle, it can throw off the whole system. So it's important to realize how well this hip can move and, kind of appreciate, how it's built and how many muscles attached to it, which we're going to get into next. So I want to briefly cover hip musculature, and we could spend a lot of time going over like the individual muscles in each group, but I just want to talk about the major muscle groups. First is the hip flexors, which is going to be one of the two focuses today. Everyone thinks they have tight hip flexors, and it's fairly true. Why are hip flexors always tight? Because they're in a shortened position when we sit, right? If you think your hips are in neutral when we're in standing, when you go to sit down, your thighs are at a 90-degree angle. Okay, so your hip flexors are shortened. We're going to show some images of that soon, so we'll dive deeper into that. Your adductors, these are your groin muscles, your inner thigh muscles. They attach from the inside of your pelvis and onto your inner thigh, and some of them even onto the inner knee. Abductors are the opposite. They sit on kind of the side of the hip. I call them like your side butt muscles, or the muscles kind of underneath your pocket. Those muscles are abductors. They move your leg away from your other leg. Your extensors, your glute max is your main hip extensor. Anyone who's been to React knows we're all about the glute max. It's a huge muscle. It brings your leg behind you. And then your deep rotators, one of them being your piriformis, which is the second muscle we're going to talk about a lot today. They sit underneath the glute maximus and they rotate the hip outwards. So flexors and piriformis are going to be our main coverage points today, because those are most often what we see as problematic in hip-related conditions. And then again, a key thing, all these muscles must be strong and mobile for a proper functioning hip. If there's a kink in the system, it's going to throw everything a little bit out of whack. So here's a brief picture of kind of most of the major muscles that attach to the hip. If you look on the left side, this is posterior view. So you're looking at the back. This is the tailbone. The glute max is cut away. Normally a glute max, it would cover all these muscles you see in here, but it's cut away so we can see the rest. Your piriformis sits deep in here. And then you got your hamstrings down here. To the right is a front shot. So these muscles up in the pelvis and attached from the spine, those are your hip flexors. We'll talk about those more in a bit. These ones on the inner thigh, those are your adductors, attach up into your groin. So anyone who may have some labral issues or groin symptoms, that's these muscles in here that typically are the culprit of your tightness. And then your abductors are along the outside. And then also up here, you can see it in the posterior view. But the flexors and the deep rotators are going to be our main focus today. So what happens when we get tight hips? So on top of the constant feeling that our hips are tight and restricting our motion, tight hips can lead to a variety of other issues. Most commonly in clinic, tight hips cause issues with our low back and our knees. Very often low back pain and knee pain, especially when it's one-sided, is very often due to restrictions in our hips, whether it's tightness or weakness, lack of stability, or most often a combination of all three. But when it comes to stiffness, if your hips aren't able to move in greater ranges of motion, somewhere else has to make up for it if you're trying to accomplish a task. And golf is an excellent example. If your hips aren't rotating the way that they should, you're not able to, but you need to rotate through that swing, another joint has to make up for it. And in that case, we often see it, it's your back. Your back will have to rotate or side bend extra to complete that task. When in reality, the hip should be doing most of the work there. And eventually, if your hips stay tight, you can develop conditions such as hip arthritis. Often arthritis can be a genetic component, but if your hips are chronically tight and you're not addressing that tightness, it can cause the hip, that femoral head to move differently within the joint. And when that happens, you can get bone-on-bone rubbing. And what happens when we get bone-on-bone rubbing? Bone spurs form and we get arthritis. Labrum issues are fairly common that we see, especially when it's, if it's chronic labral degeneration. Hip tightness can be a source of that. Sacroiliac pain, piriformis pain, which we will get into a little bit later, and then even sciatica. Again, this isn't to, scare anyone and say, just if you have tight hips, you're going to get one of these 5 issues. But it's one of those things, if you realize you have an issue, especially if it's one side versus the other, you got to take steps to address that so that you can, avoid some of these potential conditions. All right, so now we're going to talk a little bit more specifically into the 2 main muscle groups, starting with the hip flexors. This picture in the middle is one of my favorite pictures of the hip flexors because it allows you to really appreciate, what these muscles look like and how much ground they cover. All right, so there's 2 major hip flexors that we talk about in this picture. Your psoas, which is starting here from your lumbar spine. And notice it attaches to 4 different vertebrae. I believe it's L1 to L4. Comes all the way through the pelvis and attaches at the front of that hip. Then you have your iliacus, which covers, starts on the inside of your pelvis. You put your hand on the side of your hip. That's a lot of ground. And when you go on the inside of it, it's bulky and comes on the inside, and they actually attach together. So if you're sitting throughout the day and your hip flexors are shortened to 90 degrees, as opposed to, standing when they're in neutral, these muscles are going to get tight and they're bulky. If they're chronically tight and, week after week you're spending time sitting and you're not exercising and you're not working on, stretching them out or any kind of strengthening routine, they're going to cause issues. And that's why a lot of times too, when the hip flexors are tight, we see a lot of low back pain because of where they attach. They actually attach with the discs in your lumbar vertebrae. And disc pain, you may think that you have a disc pain, but very often it can be the hip flexors that are really tight. That's why I want you to look at the picture over here to the left. This is your pelvis and your spine. We kind of call this crossed syndrome. These muscles, your hip flexors are at the front of your hip. They attach to your pelvis to the front of the hip. If they're really tight, every day they're getting a little tighter. They're going to slowly tilt that pelvis forward and shorten it, and put you in a bad posture. That's going to cause extra arching in your back. And then it's going to cause the muscles that do the opposite to be lengthened and a little bit weaker. And so I think these 2 pictures are really good to appreciate, how big these muscles are. And if they're tight, they can really throw your whole thing out of whack. And, pelvis is where it all starts. That's your base. So you want to be at a good base. If you're not, it can down the chain, it can mess with things as well. Another good picture, hip flexion versus extension. So if you think your hip flexors are tight, they're not going to allow your thigh to extend behind you like you see in the picture to the right, hip extension. Okay, and hip extension is what your glutes do, which is why we preach glute strength is so important. But if your hip flexors are so tight, and you're not working on, stretching them or extension, your glutes are basically, they're not going to engage the way they should at the hips because, that thigh is not able to go behind you. And so they're not able to do their job. Your glutes, they do extend the hip, but they also keep us upright and are huge for our overall, static posture. So again, if the muscles that do the opposite, your hip flexors are tight, they will affect the way the glutes turn on. Same idea if you look at the picture to the right with the abdominals. Go back. If your hip flexors are tight, it lengthens the abdominals and it causes more arching in your low back and a lot of tightness in your low back. That's why with low back pain, we say, you got to strengthen your abdominals as well. Same idea there. If your low back's really tight, it lengthens your abdominals and causes weakness there. So again, this is really, abs and glutes. That's kind of the React mantra. That's kind of what we always preach. But we see that hip flexor tightness is a main preventer of those muscles working the way they should. And again, we're going to get into demonstrations and talking about how you can loosen up the hip flexors. But I like these pictures so you can kind of appreciate, their importance on the system overall. All right, so now we're going to briefly talk about piriformis tightness. This has probably been the most often complained about muscle of recently, which I do believe is because of change in workstations with the pandemic. Everyone's working from home, which probably means they're sitting more because they're not walking to their car or walking into their office or whatever it is. Even those small little walks can be game changers. So piriformis syndrome or piriformis tightness, we literally say it's a literal pain in the butt. Okay, you look at the picture to the left here, it sits deep in that pelvis underneath your glute max, attaching from your tailbone over to, it's actually attaches a little bit further down the femur than what it's showing in the picture. But when it's tight, especially with sitting, you'll feel it. The issue that we're finding is that people are coming in saying they have piriformis syndrome, which I'm sure some of you may have heard, and they don't have piriformis syndrome. Piriformis syndrome is a very vague issue, and I think a WebMD, you search, you have butt pain or piriformis pain, and right away they put up this piriformis syndrome, and everything that's what they have. Just because your piriformis is tight does not mean you have piriformis syndrome. Piriformis syndrome is typically when there's severe neural symptoms, sciatica. And when I say sciatica, I don't mean like general pain in the hamstrings. I mean like pain down the leg, chronic, always feeling with your laying down, and then or numbness and tingling in the leg. So again, piriformis, just because you have tightness doesn't necessarily mean it's piriformis syndrome. But either way, those of you who have tightness there and pain there, sitting can be uncomfortable. Getting in and out of a car can be uncomfortable. And that's because basically this muscle here is in spasm. And I'll show you another picture here. If you look at the left, so there's a picture of the glute, and real quick, appreciate how big that muscle is. When that muscle's cut away, it's got all this stuff underneath. But the glute covers all of that. Okay, so very powerful muscle. When this gets weak, that can cause piriformis to work harder. Okay, if we're not strengthening our glutes properly and they're shutting down, something else is to pick up the slack. And very often we find it's the piriformis or the hamstring. Obviously, the piriformis is our focus today. But I like this picture too because it shows the sciatic nerve. And that's why sometimes piriformis tightness is associated with sciatica. The sciatic nerve runs right underneath the piriformis. The piriformis is a big, bulky muscle. So if it's tight, it can pinch on it. I like to think of nerves as like trains. Trains move one way or the other. They don't really, they can't stretch. Nerves are similar. They can stretch a little bit, but they don't necessarily like it. Think of muscles as a tunnel for your nerve. So if the train's going in a tunnel and the tunnel collapses, it's not going to be able to move one way or the other. Same idea with muscles and nerves. If the muscle tightens up, think that's collapsing on the nerve. If it's in spasm, it's going to squeeze on that nerve. So when you go to move your leg, especially if you try to straighten your knee out or even bend at your back, thinking about it from both sides, above and below that muscle, anyone who's had sciatica in the past knows that those are difficult motions because that piriformis can spasm and yank on that nerve. That's why, putting your legs up when you have that sciatica helps because that helps relax the piriformis. But our goal is to relax that muscle. And to do that, we find we need to do some sort of stretching or active release or needling, whatever it is, and to strengthen around it so that a muscle can eventually calm down. Another picture to the right is just another visual of that nerve. With sciatica, you also get tightness in the hamstring. So recognize the hamstring does kind of cover that sciatic nerve. So again, with the glute max, something picks up the slack. If your glute max is weak, often we see it's the piriformis and the hamstring, which can cause spasm over that sciatic nerve. All right, so that's all great and all right, but why is my piriformis so tight and how do I fix it? Well, we kind of talked about that earlier. History of injury and compensation, for moving differently because of an old injury, that can cause poor mechanics and cause over-facilitation of the piriformis. Sitting position, whether you're sitting on an uncomfortable chair, whether you're slumping a lot or you're leaning too far forward, whatever it is, sometimes if you're leaning towards one side more than the other, that can cause flare-up in the piriformis. Guarding, if you have a fall, if you're in a car accident, we see true piriformis syndrome after car accidents a lot. Your muscles and brain can sense something's not good, and the muscle spasm that's trying to protect you. So sometimes that's the case in more severe conditions. But most often, which is why I started, is its weakness of the muscles around it. Poor training techniques, poor isolation of working the glutes, whether it's the glute max or even the muscles to the side, like your side butt muscles that I talked about. If those muscles aren't strong and then you try to, exercise and are doing something that, that your muscle can't tolerate and fatigue quickly, that piriformis tends to kick on. So the goal, and, we're going to talk about this during the exercise, demonstration portion is, if it's piriformis is tight, you want to work to relax the muscle, whether it's stretching, foam rolling, active release. In more severe cases, maybe heating it or, sitting on something comfortable. And then you want to strengthen around it, which is what we're going to talk about in our exercise regimen. So this is kind of, my thought process with, this isn't just for hips, but really with anything. For someone who's coming in with, muscular based pain or joint tightness, you want to stretch and release, relax the muscle that's overworking, excessively tight. And then you'll see in the, you want to do that for about 30 to 60 seconds, whether it's the stretch or the release. You want to activate the weak muscles that are around it in the hopes that it'll help relax that piriformis. Functionally strengthen, I have that in quotes. Functionally strengthening is kind of a buzzword now, but that basically it just means you're doing an exercise that mimics, something that you do day to day, standing up and down. So squatting, climbing up and down stairs, step ups, things like that. And then working on stability. Sometimes, if you follow on Instagram, I recently did a post that, some people have, they feel that their hips are tight, but their range of motion is actually good. Sometimes your hips can be tight because the muscles can sense the hip is unstable because it's a little weak. So working on stability with strengthening can also be shown to improve, lessen joint tightness and improve overall symptoms, which is why we usually leave that for last. So I'm going to stop screen sharing here and see. I'm going to open up this time now for the chat room. If anyone has any quick questions about what we just went over, not talking about any exercises yet, you can post that in the chat there. And I'll keep an eye out on it. The next section was we're going to go over the exercise demonstrations, which is mostly what people like for this. Again, the focus here, because of what we see most often in clinic, is on hip flexors and piriformis. Again, if there's someone out there who has, maybe groin pain or pain right in the side of the hip, or, hamstrings that they feel associated with their hip. We're not going to cover that today. My email will be posted on the last slide, and I think it's included in the email that Ashley sends out. But feel free to email me. I have lots of different home exercise programs for certain things, so I can certainly help you with that. But our focus will be piriformis and hip flexor stretching and release. But as far as the strengthening components, that's for any condition. So it's really just the first slide that may differ for you depending on where you're tight. But the rest will be, I basically picked a few exercises for each of those sections that I do most often. And those are going to be good for anyone. All right, so I don't see any questions. Let me make sure Q&A. Yeah, so I'm gonna share my screen again here. View slideshow. All right, so first one we're going to talk about is a muscle release. We're big on using lacrosse balls at React, a foam roller, or a tennis ball. It doesn't have to be a lacrosse ball, but something small enough to get in there. So in the video, I'm going to turn the music off. I'm basically placing the ball literally like on the butt. There's no trick to it. Like, don't get too caught up into like where exactly am I putting it. You literally just put it on your butt and try to find a place. You'll kind of see me here. Kind of shimmy it around, find a sore spot. Once you find it, you're going to turn your hip in and out. Again, the goal here, this is especially important if you're going into an exercise routine or you want to work on your hip tightness and you're going into it and you feel that tightness in your piriformis or anywhere, within that gluteal area. Doing this prior and releasing it can be beneficial for getting the exercises. So that's why we like releases. So again, I'm going to show it here. You place the ball in your butt. Go up on your hands and heels, and then you're going to turn the hip in and out until you feel that muscle relax or it feels less sore. If this is too much here, you can always lay down on your back rather than putting your full weight on it. If this is too sensitive, because some people are going to be a little more sensitive than others there. But that's definitely one of the fan favorites. And then if you don't like doing active releases, you prefer stretching, there's the shin box stretch. Which is this here. Again, another piriformis stretch. You'll stretch a few different muscles here, including your glutes, but it's a good way to isolate your piriformis. We call it the shin box because you'll see I'm kind of making a box with my legs. My knees directly in front of my hip, and my shin angle is at a 90-degree angle with my knee, and then so is my back hip. This position may be a little bit tougher for some. There are other piriformis stretches that you can find online, Google, that are pretty basic, but I wanted to give you guys something that was maybe a little different that you haven't seen before. So here you get in a sitting position, and maybe right in this position, you'll feel the stretch. If not, the key here is keeping your back straight and slowly leaning towards that down hip. And right away, as you come down, if you keep that back straight, you're going to feel a deep stretch, like way in the glute, really underneath the glute and in the back of the hip. Typically, you want to hold stretches for about 30 to 60 seconds, but you can also make this dynamic too and kind of lean in and out of it if you're not someone who likes long duration stretching. Similar to the pigeon stretch, if we have any yoga fans out there, but a little bit more functional because it also teaches you to keep a straight back as you're hinging forward. So this is also one of my favorites in clinic. All right, number 3 is hip flexors. So a hip flexor stretch. The couch stretch is a popular one. This is similar to it. This is an excellent stretch for a few reasons. One, padding's just for the knee. But in this position, before you start, the key is engaging your abdominals. You want to kind of tuck your pelvis forward. So if your pelvis is tilted down this way a little bit, for those who have really tight hip flexors, you just want to engage your core, kind of tilt your pelvis, kind of tilt your belly button in. And then secondly, you want to squeeze your glute. Getting a glute contraction is going to pull that hip into extension a little bit. And again, some people right in this position without even leaning forward, they get a stretch. But if you're not getting a stretch yet, you're going to slowly hinge forward. Notice I'm keeping my back straight. My spine is level. My hips coming behind me. I'm not flexing forward. and I'm keeping my weight towards that front foot. You want to keep it gentle. You don't want to be cranking on your hip flexors because that's just going to cause them to tighten up again. So this, again, as you see here, this is a bit more of a dynamic one. Dynamic meaning I kind of lean into the stretch and then I lean out of it. So good movement prep. But again, if you're someone who really wants to work on that flexibility, long duration holds are key. So 30 to 60 seconds. Again, a good way to open up your hips prior to, to exercising. And the last one isn't necessarily for a specific muscle, but it works on hip internal rotation, which we didn't talk about a whole lot in the slides. That's because there's really no true internal rotator of the hip. It's a secondary function for most muscles, but that does not take away from how important that motion is. Hip internal rotation, which you'll see here, is basically your, if you think your kneecap or your knee is turning inwards, that's where we'll see, lack of hip internal rotation. We'll see a lot of groin pain or, groin issues, labral issues. But opening those up is key, especially if we're doing things like, squatting, especially single leg squatting or lunging. So a good way to work on that is you're sitting up against a wall. Both my feet are flat on the wall and I'm squeezing a yoga block. You can squeeze a pillow, you can squeeze a, a folded up towel. But the idea is you're kind of remaining stable between your thighs. And then you're slowly going to turn your hip out. This is fairly stiff. I have fairly stiff hips into this. This is one I definitely need to work on. Some of you will be able to turn it way out. But if you're someone like me and you do this and you notice it feels really tight in the hip joint, this would be a good one for you. Again, this is just another way to open up the hips prior to a workout. Turn all the way out, come back in, and you'll do about 2 sets of 10 on each side. This is one too where you can really see how hips move right versus left. If you are someone who has low back pain, especially one-sided, or knee pain one-sided, I would guess that you're going to find that side that hurts more is going to be a little bit stiffer on that side into that motion. So movement prep. Again, you can do all of these. You can do ones that are just specific to you, but all these can be pretty beneficial for as you get into your exercise routine. So next, muscle activation. So pretty brief area, but again, very often with hip, low back, knee pain, we find weakness of your glute maximus, which is what we'll cover first, and then your glute medius and minimus, which are your abductors. So let's get this one going here. So everyone, if you know us, you've probably been to React or, are somewhat familiar with physical therapy. So you've probably heard of a glute bridge. I wanted to give you guys, again, something a little bit different than a single leg or a double leg glute bridge on the ground. So this is a single leg bridge just elevated. Again, you can use the edge of a coffee table here. It doesn't have to be a bench, but you'll see, if my left leg is the involved leg, I'm putting my heel on the edge. I'm holding my right leg in the air, and I'm going to go up, push through. I'm going to hold that for about 3 seconds. And the idea with the muscle activation phase, isn't necessarily to build a ton of strength. It's to get a feel for, what muscle am I working on? In this position, if I was doing this now, I would feel a good full contraction in my glute. And it's a good way to get an idea of, all right, so that's the muscle I want to work, wake it up a little bit. It's not that it's, shut off, but you want to wake it up. That's why we, what we refer to when we say muscle activation, and doing it repetitively with, 2 to 3 second holds can help do that. And again, I'd always do both sides, but especially the side, the involved side that you're having issues on. So just another way to do it. If you prefer, if this is too difficult, you can put 2 legs onto there and just focus on one side as you do a double leg bridge, or you can do the classic one on the ground, either double leg or single leg. But that is a single leg bridge elevated for your glute max. Your glute med, let's see here. You can always do leg raises on your side, which is a pretty common one in PT. All right, unfortunately, this video is a little short, but I'm almost in like a side plank position as if I'm getting ready to do a side plank. But the key is here, is that I'm on my knees, both my knees and my feet are on the ground, and I'm driving through the outside of that knee, and I'm tucking my butt in. Okay, a clam plank. So right away, you will feel it in your abs, on your obliques on the downside. But the idea is you're driving that outer right knee in, or I guess my left knee into the floor, and tucking your butt in. And right away, you're going to feel muscles turn on the side of the hip, kind of in your side butt. And it's called a clam plank because if you feel so inclined, you can raise the right leg up on the top into like a clam position. And again, you're stabilizing at the top hip as well against gravity. So again, another one of my favorites here, a little different than what you may have seen in the past. So again, I wanted to show you something a little different, but a side plank on the knees, driving through the knee, not only will work your abs, but it'll wake up those stabilizers on the outer hip. All right, next slide. All right, functional strengthening. So, squatting, I think you hear it's one of the best exercises you can do. It's functional because, more often than not, all of us are sitting up and standing. When you're sitting up and standing above the couch and sitting down, that's a squat. And you want to be good at that because, again, it uses so many different joints and so many different muscles and engages them all. And, it's full body. So I'll briefly go over squat form here for those who may not have been taught in the past. Squat, you want to get your feet shoulder width apart. And the key is getting your butt back as you come down. Okay, so notice here, my butt's back behind me. My knees aren't coming too far over my toes. I'm not super picky with knees over toes. Some people encourage it. Some people will say, you can't go over. I'm not really picky. My goal is seeing that you're able to keep a straight back, your shoulders are square, and your knees are flaring out a little bit. And it's in a controlled manner, and you're going down in a comfortable range of motion. Here I'm in a full deep squat. If that hurts, especially for those who have pain in the front of the hip, you don't have to go that low. You want to go down into a comfortable range. But again, you should find if your hips feel really tight and you do some of those movement preps like I showed earlier, whether you foam roll your hip flexors or do that hip flexor stretch, you should find improvements carry over to your squat range of motion. So, this is kind of where I would start. You can add weight to this. You can add holds at the bottom. There's a lot of ways to vary it, but that's kind of what a squat should look like, getting your butt back and opening up at the hips so you're able to use that range of motion and as much range of motion as you can, because that is key. The next is a Bulgarian split squat or a rear foot elevated split squat. Again, same idea as a squat, but you're focusing on one leg. So my left leg is behind me here up on a bench. Coffee table works as well, really anything. You can even use a stability ball like you see on the treadmill there. But the key is your back leg is more of a kickstand. You want to think like 90-95% of the weight is through that front foot. And then same idea with a squat. I'm going to keep my back straight. I'm going to get my butt behind me. My knees not flying over my toes. And this is an exercise, if you do it today and haven't done these in a while, you're going to feel it in your glutes the next day. The lower you get, the more that glute's going to engage, because here I'm loading the muscle, I'm stretching it out and then exploding up. Okay, this can be a game changer for hip pain and hip tightness. You will find after doing these that if you get that glute going and you strengthen enough to where you're challenging your body, you will find your hips will feel better the next day. Obviously, you don't want to go crazy. So if you haven't done these in a while, I wouldn't add weight to it and I'd take it slow. But if you get through a set of 10 to 12 and it's easy, maybe hold a kettlebell or add holds in at the bottom to make it a little more challenging for you. But again, these are one of my favorites as well because of how it isolates one leg. Doing it in front of a mirror is key too, so you can keep an eye on your form. So again, those two muscles are great for the glute max, squatting and single leg squatting. Split stance or a split squat with a twist, literally with a twist. You're going to come down. Let me get you here. That's a split squat there. Your feet are separated. You drop the back knee, but you keep that left knee from flying too far forward. So not a lunge. It's a split squat. You go straight down, holding a weight. And then for those who are maybe a little more advanced, by twisting, you're forcing the muscles that rotate the hip and your core, your obliques and your outer glutes to engage and to work on, this is a little bit of a combo of stability and strengthening here. And then you're going to reverse the motion, come in and back up. Anyone with back pain, I would avoid doing the twist with the kettlebell and I would just stick with split squats. But if you're in relatively fit, not too much pain, I would recommend adding in this twist. I mean, obviously it's going to work your shoulders too, but it's going to teach those hips how to control how you're shifting your weight over not only the front hip, but also the back hip as well. I'll show it to you one more time here, all the way out, all the way in. Okay. All right, so those are the three kind of functional strengthening. There's a ton out there. So if you're someone who prefers lunges, reverse lunges, step ups, those could also be included here. But I like sticking with squats and split squats. I like to keep it pretty simple because of how, quote unquote functional they are. All right. Last grouping is your stability with mobility. This first one was a post that was on Instagram recently. This is one that I've kind of recently discovered, especially with, working with a lot of golfers. It's called a hip airplane, hip airplane assisted. So if you've heard of a single leg RDL, or even a double leg RDL, deadlift form, the key is hinging at your hips and keeping your back straight. So with this motion here, I'm going to assist myself. So I'm getting a good position. I'm holding out with my right arm so that I'm helping with a bit with my balance. And what you'll see me do here is I'm going to rotate into the hip, which is hip internal rotation, slowly making sure I'm stable. And then the key, rotating out on the hip, external rotation. Okay, this is one where you'll feel a stretch on the inner thigh, most likely, maybe all the way down the inner leg a little bit. And then I just reverse the motion. Really good exercise, not only good for the hips, but great for the feet because of, its balance component, how hard that foot has to work to keep the foot down and to keep your whole body stable. This may be a little challenging. So you can always put let me restart it. But instead of foot up, you can put your right foot on the ground like a kickstand in the last one and just work on rotating with both feet down, but emphasizing that front foot. And then if this is too easy for you and you want more advanced, you can certainly do it without holding on, which is very advanced, but a very effective way to work on stability through the hips. But by working on getting to end range of motions, you're working on mobility as well. So great exercise for any of those out there who are flexible on their hips, but feel that their hips are still very tight. And most likely it's because of the joint sense feeling that it's lacking stability. And then the running man, another one that you can find on Instagram that I've done a post on. You don't have to stand on plates. By standing on plates, it makes your foot work a little bit harder. But if your focus is at the hip, early on, you can just stand on the ground. You can also hold on to something like we did in the last one. Up here, driving up. My second one's usually a little better. There you go, right there. So an RDL like before, my back is straight. I'm hinging at my hips. I'm not flexing at my back at all. And my knee's not coming too far forward over my toes. That's probably a little further far forward than I'd like. But again, I'm stable here. I'm going down as far as I feel comfortable without, losing my balance. And then I'm driving through that right leg and working the other way. Here, you're going to get your glute, your quad and hamstring going, your feet going, and the opposite side, getting your hip flexors working as well. So great stability and mobility exercise to work, especially in that sagittal plane as far as your hip flexors, your extensors, because you will feel a stretch for those who have tight hip flexors in this position because you're extending slightly at the hip, but it's also a great exercise for building power for any athletes out there. So those are all the exercises here. And again, all of these are going to be sent to you guys after. You will get a link, so you will be able to get to see all of these. If there's any issues with the videos, again, email me. I have these all saved on a computer, obviously, so I can send them to you in a more outlined format. Before I stop sharing my screen, I just want to go over these so I don't forget them. Right now, if you are dealing with pain and stiffness, weakness, hips or anywhere, I just want to remind you, you don't need a prescription from your doctor anymore. You can come right to us. Unless you're Medicare still requires a script, but any other insurance, you can come right to us. We send a script to your doctor and he will sign off on it. React specifically is specialized in soft tissue techniques and joint mobilization techniques, which I'm sure most of you know. That's when we're usually digging our elbows and hands into you. Those are the active releases. And we also do dry needling. Any clinic you will find dry needling, which if anyone's dealing with hip arthritis out there, considering surgery, dry needling is a very effective way to avoid surgery. Another reminder, you can now schedule online at React. You can schedule an appointment with any clinic if you don't want to call. If you have any questions, you can email me. And then you will all be getting a link to this webinar today. So I'm going to stop sharing my screen. All right, so I hope what we went over today was helpful. I'm sorry if I spoke a little fast. I know I'm going over on time a little bit, but I like to kind of split it up so you at least early on be a little educated and a little understand of, what goes on at the hip, and how many muscles are attaching there and how many things are at play. But I know that the exercises are the main draw to these. So again, anyone out there, if there's any issues with the link, or you want me to cover anything in an email, just email me. I'd be happy to go over it with you. All right, I just got a question. When do you recommend needling for the piriformis? Needling for the piriformis, I would say if you have active pain, pain there. So if your piriformis is just generally tight, and it has been for a while, but that stretching can relieve it, I wouldn't recommend needling it. If it's painful, if you're sitting on a chair and you get pain in there after 10 to 15 minutes, if you're getting pain there with sciatica down the leg, needling will definitely help. So that's the next question. Will it help with sciatica? Absolutely. Because what it does, needling and active release, what we do here, it works to loosen the muscle, break up trigger points. And when that happens, we find it relaxes, which takes the pressure off your sciatic nerve. It will take a few rounds, and it's, it definitely is uncomfortable to get if you have a tight piriformis. But we do find needling is a very effective way to do that in combination with the strengthening exercise that I shared. Everyone I needle, they don't just get needling, they always have to do exercises after, because I can needle the piriformis, it can relax, but it's tight for a reason. So I always recommend trying exercises and stretching first. But yeah, for anyone out there who thinks that has been working for them and they need a little extra push, I encourage you to call one of our clinics and see if you can get in for some needling, or maybe for some some real specific soft tissue releases. Because yeah, again, that's why I chose to do piriformis, because we're seeing it a lot. If you are out there, you are not alone. Please call us if you've tried exercises similar to this and it hasn't worked for you. We can definitely help. But I do hope that the information was organized well enough so that you can get a pretty good home routine. If there's any other questions out there, please let me know. Can leg weakness without pain be helped? Absolutely. That's a tough question because it depends on why your leg is weak. I mean, if it's if you feel you're weak and you're not exercising, then absolutely. I mean, you can definitely get improve your strength and improve your mobility through strengthening. And we find the stronger your muscle is, the more flexible and the more range of motion it can have. Obviously, there's other reasons for leg weakness. So if it's lumbar associated, that'd be for a different webinar. I don't want to dive into that too much. But leg weakness without pain can certainly be helped because it's going to be easier to strengthen. You'll be able to do more. You just may need more simpler exercises than what I went over today. Any other questions related to the hips, related to scheduling with React, related to any modalities we do? Doesn't look like it. So again, thank you so much for attending today's webinar. I hope it was helpful. Are there any exercises that are bad for the piriformis? There's really no exercise that's bad for the piriformis. Here's the thing, exercise, anything you do is going to be better than doing nothing for the most part. Obviously, if you're in severe pain, pain down the leg, there's some things that may aggravate it. But for the most part, any sort of exercise, walking, light stretching, basic sit to stands, that's all going to be good for it. Pain, remember, pain doesn't always mean harm. Pain is our brain's way of telling us that, something's off. But at the same time, pain isn't always a bad thing. So sometimes we do have to work through some pain. There are no exercises that are bad for it per se. That's same for the hip flexors as well. I mean, you don't want to go too crazy with stretching, keep stretching gentle, but otherwise, no, I would say, there's really no exercise that you need to be overly cautious of. Any other questions? If you got them, keep them coming. I got a couple more minutes. All right, it doesn't look like it. So I'm going to end the webinar here. Again, thank you all for coming. I hope you attend more webinars in the future. We're going to keep rolling them out, I think either once or twice a month. And give us a call if any of you out there are dealing with any of these issues. All right, thanks guys. Have a good day.